What the heck happened last night? Or yesterday, rather? September 22nd, with the big announcement. I think a lot of us anticipated, can't wait to talk to you more about vaccinations, by the way, that's coming up in the show. But I think the anticipation was, somehow some justification as to the position that vaccines might be contributing to predisposition of autism. So it's multifactorial, you'll explain that to us. But acetaminophen?
Well, I mean, it was a big week, right? And it was a big press conference, and it's still very fresh. But I think a lot of people are certainly frustrated, and there's a lot of differing opinions on with that this announcement. You're talking about seating. We talked about this for a while. I mean, Secretary Kennedy said months ago that we're going to have a big announcement in September, and I think a lot of individuals were waiting very diligently to see what would be said, what new evidence they had, what would they be coming out with, and realistically, what they came out with yesterday wasn't really new. I mean, they definitely did focus on acetaminophen and Tylenol and also leucovorin, and I think that both those things are reasonable. I think that those are both things that when people are attacking the administration, it's not really reasonable to attack them on that. I mean, there have been plenty of studies on acetaminophen. There has been a lot of concern around it for a while. There is a recent study from August from the head of public health at Harvard, so pretty science-based guy or individual, I would assume, who put together a literature review of over 40 studies on acetaminophen in pregnancy and Tylenol, and concluded that there is some level of concern. It's not consistent at every single study, but the majority of good studies do seem to lean in the direction of a small but appreciable risk of an increased risk of autism from Tylenol use in pregnancy. And with that study, I think it's completely reasonable to provide caution, to provide concern. With the rising rates of autism and the concern around autism, we should take precaution. And Tylenol is the most used, or one of the most used medications. It's certainly the most used pain reliever in pregnancy, and people use it like it's candy sometimes. And every medicine has a risk, and we should be conscious of that. And we're very conscious to tell people not to use Motrin or ibuprofen, or not to use too much aspirin, and those have known complications. And I don't know why Tylenol would be any different. So I think that's reasonable. I think there's a biological plausibility. It's not 100% for sure. There are studies that don't show it. There's a lot of pushback with the Journal of the JAMA study, Journal of American Medical Association study from last year. That was a massive study, 2.5 million kids, and they didn't actually find an association. They studied for genetic differences, so it looked at siblings, and the actual findings didn't show after that. So there's more research that needs to be done, and it's not definitive, but totally reasonable to make the announcement on that. Totally reasonable to warn people. Totally reasonable to not take Tylenol if you don't absolutely need it. Fevers in pregnancy, also a risk. Severe pain, also a risk. So those are things you have to weigh, and sometimes you need to take a medication. Sometimes people, we know that antidepressants can cause issues in pregnancy, but you might need it. Your blood pressure medication might cause an issue in pregnancy, but you might need it. So you have to weigh with your doctor whether the risks that are known from the medication are still warranted, given you still might need the medication.
Right.
So I think that's the way we have to look at everything, and that's reasonable. And also leucovorin, there has been tons of research on it over the last 5 to 10 years. It's become much more popular. A lot of mainstream doctors are using it and have found great benefits for some patients. So I think it's a very reasonable thing to offer patients, to bring awareness to discuss more so people can try it. It's basically a supplement, and so why would we not want to offer that with something that's minimal risk? And everything has risk. That's very minimal risk. And if you're going to see great benefit for some kids, and that's a wonderful thing to promote. And we want more research. I don't think any of this stuff is definitive, but we want to discuss this. And I think it's the first time where we really had this kind of conference on autism, an acknowledgement that it's increasing, an acknowledgement that we want to do more to look into it. And there was a lot of discussion around increasing research. So I think all of that was good. And I think the motivation behind generally having a conference around autism and trying to look into it is good. I think not everything that was said in the best possible way, and I think some of the things were maybe overstated or said in ways that maybe could have been done better. But ultimately, that's the reasoning behind it, and I'm not totally upset. I think it's very good based on where I've been that we are talking about this, but just not maybe the way that I would have personally done it.
Sure. Well, yeah, so sometimes the message is as important as the messenger.
Sure.
And
I think opening the door is the most important thing to the conversation.
that's science.
Yeah.
Remaining open, having the conversation. You've written a lot about this, and you've lectured a lot about this, the incidence of autism.
So this is to put in context what you're talking about, Dr. Joel. So first study, international study done on autism, 1979. 1 in 2,500 children diagnosed with autism. 2000 in the US, we leapt to 1 in 150. Today, the latest CDC numbers, 1 in 31 in the US. So we've gone from 1 in 2,500 to 1 in 31 in the space of 40 years.
Yeah, and 1 in 12.5 boys here in California, which is insane.
It's
and you still get this media context of, we're just better at diagnosing.
Yeah.
That's not true, right? I mean, we are better at diagnosing it. There's no question about it. That's one part of it. Yeah. But there aren't 1 in 12.5 adult males in California with autism. It is happening more. Everybody who works with kids knows that. Yeah. And two things can be true at once. And we have to acknowledge that it's happening more, and especially that more severe autism happening more, which the most recent data shows about 25% of cases have very severe autism, severe verbal communication issues, and that's important. Yes, some kids with autism do fantastically well and don't need any support, and that's wonderful, but a lot of families do. And with the rise at the rate that we're seeing it, some small part of it is probably better diagnosis, but it's just happening a lot more, and we need to figure out why. And looking into Tylenol, totally reasonable. We should be looking into many things. And to me, the conversation should have been, well, here's the research we have around Tylenol and acetaminophen. Seems like a reasonable thing to avoid if we can. Here are the other 10 things that we're looking into. We're going to get more research. They did talk about getting more research, but it should have been the focus to me, because ultimately we do need to look into this more.
Absolutely. And as we remain balanced in this conversation, I just want to bring up this whole notion of causation and correlation. So correlation doesn't always, and actually quite often, doesn't equal causation. One of my favorites ever is that the per capita consumption of margarine in Maine correlates very highly with divorce rate. Like, it's almost a perfect. So is margarine causing divorce rates in Maine? No, or at the very least,
most
likely no.
Not, yeah.
Right, but could it warrant further investigation? Maybe, if you could sort of logically extrapolate the reasoning behind that. But one thing you said just now, and something the naysayers are now currently arguing about, or the opposite side, this is not a black and white issue, and it shouldn't be a red or a blue issue. But what they're saying is 60% of pregnant women are taking Tylenol. Those are their numbers. And if 60% of women taking Tylenol doesn't relate to 60% or close to that rate of autism incline, because these numbers are staggering. Part of that's because they're also maybe taking it occasionally or very conservatively. I think what we're concerned about are parents or moms, pregnant moms, taking it all the time, or doses beyond what are considered. Because now what we know is a single dose is actually hepatotoxic, right?
Right, and that's absolutely correct. And that goes back to the reality, which is autism is multifactorial. There are many things involved, and genetics are certainly involved, like with anything. And so just because you take a medication, 100 people can take the same exact medication at the exact same dose, and most of them will be fine, and maybe one isn't. And ultimately, we need to figure out who that is. But when you have a medicine like Tylenol, where let's say 50% of people are taking it, and some people are taking it again like it's candy, like it's nothing, then that is where it is important to make these announcements, because people have to understand that medications have consequences. Tylenol absolutely has consequences, and with that kind of acknowledgement, then maybe people won't take it just because. They'll take it when they really need it, but a little bit of pain, a little bit of a headache, a low-grade fever, maybe those are not the times to take medicine. And that's no different than when I talk to my families in the office, right? This isn't about autism. It's my kid has a cold and a low-grade fever. You don't need to take Tylenol. Like, there's no reason to do that. Fever in general is your body's natural response. It's a good thing. It's helping you to fight off the infection, and presuming it's not a really, really, really high fever, 105 or above, or they don't have very severe symptoms, let the body do its thing. You don't have to give a medication. You don't have to suppress what the body is naturally doing, and they'll get better on their own. And I think if we echo that message, then that's no different for this than almost any medication. But I think that the messaging for so long in America especially has been, oh, we have a pill for everything. You have a little bit of headache, you have a little bit of pain, a little bit of fever. Here, this medicine, take it. It has no side effects. And that's not true. And this is showing that, because even if it's a very, very small effect, which is what the research shows so far. If everybody's taking Tylenol, then even a small effect has a huge difference because there are some people that are going to have genetics or an environmental situation where that's going to throw them over the edge, or maybe it's when you take Tylenol, or maybe it's Tylenol mixed with the reason why you're taking Tylenol that leads to autism. I don't know. That's what they're going to have to figure out. But when it's something that everybody's taking, even a little risk is a huge problem, and so we do need to understand that.
Absolutely.
Something that you and I are keenly interested in, the genomics, the backstory of autism, because again, this is multifactorial. You write about it in Parenting at Your Own child's pace. Genetically, these children in utero and beyond, they're susceptible to poor detoxification and methylation, right? These pathways, right? And that's and part of the message. And by the way, I just have to say, I've heard you say this so many times. 4 things we have to ask ourselves in medicine, and you practice this daily, Dr. Joel, is what is the benefit of taking anything? What is the benefit of not taking that thing? What is the risk of taking something? And what is the risk of not taking that thing? And if you ask those 4 questions, but the problem is so far, they haven't properly evaluated what is the ultimate risk of taking that thing.
But if we understand and just delve into a little bit the methylation that you brought up, just a very easy understanding of that is that we all have a detox pathway to work with pesticides, chemicals, heavy metals. Some people's pathway works better than others. Some people need more of the B vitamins in different forms than others for that methylation pathway to work. So we get to the notion that every child, every adult has a different threshold of capacity of what they can withstand from the environment before that detox pathway is overwhelmed and doesn't work anymore. And that's when things start building up in the body that shouldn't be building up in the body, like the heavy metals, pesticides, chemicals, which can all be neurotoxic, which can all contribute to the nervous system and brain not functioning properly. So this methylation detox pathway, it's just the understanding that everybody has a different body burden, a different threshold, and if we're aware of that, we can address it as pediatricians and parents.
Right.
Yeah, and even more than that is as a society, right? I think that's where we're getting to. I mean, we have this chronic disease epidemic. It's exploding, and adults, the latest figure, 75% of adults have a chronic disease. For kids, it's around 50%. So we have to acknowledge that this is a big problem. And like you mentioned, everyone has a different ability to detoxify, and we have amazing bodies that can. We have great livers and kidneys, and we get rid of a lot of toxins, but we're in a different world now. We're in a world where there are just so many chemicals and so many toxins, and you mentioned it right from the start. We're born being in a soup of chemicals.
Right.
I mean, that's right there. So especially if you have a not so great detoxification system comparatively, well, the world that we live in right now might just be too toxic for you, and it might spill over into some sort of condition, or maybe it affects your kidney or livers, or turns into an autoimmune condition, or whatever it is. Like, that's what we're seeing now. And when we talk about vaccines or Tylenol or all of these things, it just all adds to the things that our bodies are exposed to, and depending on your specific genetics and makeup, that can affect us in different ways. And if we can acknowledge that, if we can discuss that openly without censorship, without anger, then we can get to a place that's better. Like, what we know for sure, kids are sicker than ever in terms of chronic disease. We know that. Adults are more sick than ever for chronic disease. We have to acknowledge that so that way we can discuss it. And it can't be something where we can't say, oh, well, how do vaccines relate to that? How does Tylenol relate to that? Those are reasonable questions. They're not the only thing. There's a lot going on in the world. There's a lot that we're exposed to, but these are things that we're putting in our body, and we're talking about the most common medication or something you're giving to kids like vaccines multiple times. Parents have concerns, and we have to listen to those and address those concerns and talk about it, and then research it more, and also be honest and say what we do and do not know. We don't have to know everything, but we do need to discuss it. And before we move on from the Tylenol, I think, again, it's really important to say this isn't about shaming parents, right? This is just new information. You do what you know when you know it. And if you took Tylenol when you were pregnant, most likely didn't do anything, right? It's still a very small risk, but these are things that we need to know. If there is some sort of increased risk, we want to know that moving forward. And you did the best that you could. You took the medication that was said to be safe, and maybe now we have some new information that says it isn't as safe, but you shouldn't be hard on yourself or feel bad or shame for causing your kids autism or something like that. It's so much more complicated than that. It's so multifactorial, and I think that it's not about shaming anyone, but about getting better information for the future. So I think that's really important.
And applying it.